Hi, it's Joey Remini here from Seeking Balance, and welcome to our YouTube channel for persistent dizziness. And today I would like to talk about troubleshooting and treating BPPV, which is Benign Paroxysmal Positional Vertigo. It's the most common type of dizziness out there, and there's heaps of information around, but sometimes the information isn't really practical and comforting. You know, we have to actually understand what's agitating these loose calcium particles in our ears. And today I want to talk about, stepping through what do we have to do to treat it and why does sometimes the treatments not work. So there is a lot of information on my website, seekingbalance.com.au, about BPPV. And it's when we've got these little calcium particles that belong in our ears, but they actually get dislodged and they shift and they move into, let's say, the wrong bedroom. They're just sitting in the wrong part of the ear. But they are harmless and they are healthy. So BPPV can happen at any age, any gender. It is something that's quite common in the general population. But when we move our head, whether it be lying down, rolling in bed, bending over, looking up, when we're moving our head and rolling around, we can get this agitated spinning flurry of dizziness. So the dizziness is often visual spinning. It can provoke nausea and vomiting. It can certainly provoke some anxiety. It's really frightening and disrupting. I've had this one twice, 2 different times in my life. So what we need to do to treat it essentially is you'll need to find out which ear the calcium particles are loose within. So is it the left ear or the right ear? And you'll also need to figure out which canal it's in. So there's 3 different canals in each ear, and usually it's the posterior semicircular canal of the inner ear where the benign paroxysmal positional vertigo is most often found. And we can treat that very simply with a few specific maneuvers. Commonly we use the Epley maneuver, which you can learn about. But sometimes if it's in the horizontal canal, we may want to do a barbecue roll or something a little different, because we're moving the crystals using gravity, just gently shifting them from one bedroom of the inner ear to another. So we want them to go from where they don't belong to where they do belong. Now the thing is as these calcium particles are moving, they agitate the sensors of the ear. So the ears are designed to detect movement. And in this situation, they're detecting movement that is from particles in one place to another. So that means the person experiencing the positional vertigo will get a flurry of nystagmus or movement of their eye muscles. And that's the little calcium particles agitating the inner ear mechanisms and sending a message to the eye muscles. So all of that is actually healthy. It's just very disconcerting and frightening at the time. So first we use Hallpikes to test the posterior canals on the left and right ear. We do a Hallpike test. Now if both of those come up normal with no dizziness, then you can feel confident that your posterior canals are not affected at that point in time. And we use little roll tests or horizontal head tests to test the horizontal canal. They're the 2 major tests we use. So basically you want to figure out which canal of which ear is affected and then use a very strategic and methodical, gentle treatment to roll those calcium particles back to where they belong in our otoliths. I usually don't recommend more than 1 or 2 treatments a day. It's often very quick and effective to treat this condition. Some people do need, 6 treatments. And you can do this at home, you can do it on your own, but it's always recommended to feel safe, feel supported. I've got a video treatment kit for people who can't reach a local health professional to do this with them. And I also use the video treatment kit for people who have intermittent conditions that come and go month to month or year to year. And they take that video kit with them overseas on holidays for peace of mind. So you certainly can treat this at home. So some reasons why it may not work is that it could be that when you're going back into the head positions we need to generate the dizziness and to agitate those calcium particles, which is sort of the Hallpike test or the first position of the Epley. It could be that because of the anxiety and the discomfort, that person's not actually allowing their head to go further back enough. So they're not actually able to agitate that ear and get it on the angle we need to really get the treatment happening. So unfortunately, you often do need to really stimulate the dizziness and go through the dizziness in order to begin the treatment. And that's where staying safe and supported and really understanding what's happening before you go through it. So just getting the emotional confidence. So I would recommend that you watch the Epley maneuver a few times on a video. You can use my video treatment kit for that. Get your head around it before you even attempt doing it yourself. So really get comfortable with the idea of it. Know that during the maneuver you will agitate the calcium particles and you will feel spinning dizziness, and this might make you feel quite upset, you know, emotionally, nausea, shock, anxiety. That is all relatively normal in this type of treatment and this condition. Now, if your treatments are not working, it could be that you're actually not using the right treatment for your ear or your canal. So you may want to check whether you've got the horizontal version of BPPV. And in some people, we get this cupular lithiasis. And that means that the calcium particles are in the wrong part of the ear, in the wrong bedroom of the ear, but they're actually stuck in jelly. So it's like they're lodged and they're stuck. So it doesn't matter how many times you practice your roll, you could be doing it once a day for a week or 2 weeks and you're still not getting any improvement. And that's because your calcium particles are stuck like glue. So we often use a very gentle tapping at around the mastoid bone at the back of the ear. It's super gentle, but it's to agitate those calcium particles and help them dislodge and to become free to move. Once they're free floating, which we call canal lithiasis, then the treatments are more effective. So if the calcium is actually stuck, then we need to apply very gentle vibration, free them up, and then the roll is more likely to work. So the other, I suppose, spanner in the works is if you have BPPV in both ears, you have to really methodically and carefully treat one ear at a time. So you might decide to start the first week just treating your left ear, and then once that clears up and it comes good, then you go and treat the right ear. So it's a very step-by-step process, and acknowledging that as you shift your head position, the calcium particles will agitate the eyes and create nystagmus or spinning dizziness, and that is actually part of the treatment process. So I hope this helps clears up some confusion about why we can be trying so hard to treat BPPV and it's not working. I've also written an article just on some common misunderstandings, 5 common misunderstandings about vertigo, and one of them is that the Brandt-Daroff treatments might sort of be a bit of a generic one-stop shop, fix everything, and that's when you flop side to side on the bed repeatedly. And you know, I'm sure some of you may have tried that, but just to bear in mind, it's not an ear-specific or canal-specific treatment. So when you've got BPPV diagnosed, it is recommended that you treat the actual canal of each ear one at a time, okay, rather than sort of generically moving around, which, as you can imagine, can really agitate and confuse the situation further. So I really recommend methodical specific, canal specific treatments. There's step-by-step instructions in my BPPV video treatment kit, which I'll add a link to on this video. And I always recommend, if you have a local physiotherapist, GP, vestibular audiologist, somebody who can specialize in this area and help you, that will always be preferable. So this is a great bedside treatment. And, you know, we can treat this at home. Many people treat this at home using the video resources. It can be done. So I wish you all the best, and I hope you totally clear up your BPPV sooner rather than later in a gentle and methodical manner. So thanks for watching. Click subscribe if you'd like to connect more. If you want to ask questions, you can reply to the free starter kit. Sign up to the free starter kit, the Vertigo Essentials, on my website. And click reply to any of those emails with your question, and we'll respond on this YouTube channel. So thanks for being a part of it, and enjoy your day. Bye for now.